Beauty is how others see you, um, in terms of just your effervescence, your vibrance, how you carry yourself. But I think beauty is also what you see in the mirror.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Greg Monterosso, a graduate of Temple University School of Dentistry in Philadelphia, who completed his implant surgery residency at New York University. Dr. Monterosso trained with the world-famous Rosenthal Institute in New York City. He's been practicing dentistry for over 30 years and has performed over 2,000 cosmetic veneer cases and thousands of dental implants. So, Dr. Greg, welcome and glad to have you here.
Thank you. It's nice to be here.
Yeah, so let's start from the very beginning. What got you first interested in the medical field?
So I started when I was very young. I knew I wanted to get into the health professions. I wanted to help people. Dentistry was particularly exciting for me because I loved to work with my hands. When I was young, I'd build models. I'd do all kinds of arts and crafts and challenging type things, and dentistry just seemed like the perfect fit for me. I love being able to see something as it is and then envision how it's going to be.
Okay, so it sounds like it's a perfect fit for you then.
Yes, definitely.
Okay, now I want to talk about what kind of led you on your journey to start your business. Now, I know that you were in New York before, and you actually you were working with a lot of movie stars until the 9/11 attacks actually destroyed your practice, and now you're in Phoenix. So, I mean, that's a crazy story in itself. But what was kind of your transition from you knew you went to dentistry, you studied dentistry, what led you to start your business and basically bring us to where you are now in Phoenix?
So I started my business immediately after graduating from Temple University because I knew I didn't want to work for somebody. I wanted to do my own thing. I wanted to be my own boss. Really, one of the reasons why I went into dentistry is I didn't have to work for anybody. So I started my practice from scratch, literally right out of school. Learned how to run a practice, learned how to run a business. It's just been, it's actually a challenge every day for me to find that equal balance of being busy enough so that I feel like I'm helping a lot of people, as many as I can per day, yet not being so busy that you are rushing through things. So I'm always, for certain procedures like veneers and for implants, they know not to interrupt me, that when I'm in that room, I'm 100% focused and they have to take care of everything else. So to answer your question about, moving to Phoenix, my wife is also a dentist. She graduated from Columbia University in New York, and we both practiced in New York City for years. And one day just decided we wanted a change. We wanted warmer weather. We were tired of the cold, tired of the ice, tired of the snow. And we looked at Florida, we looked at Arizona, and we decided on Arizona because it's just such a beautiful place to live and to work.
Okay. So you have your practice here now. And so I want to talk about some of the treatments you provide, but some of the most common treatments that you provide to your patients. So I believe that the all-on X or the all-on 4 is one of the most common ones that you provide. Could you explain that to people who have never heard of that procedure?
Sure. So it's a procedure where if somebody comes in and they've spent years in the dental chair or no time at all in the dental chair, but their teeth are in a position where they're loose, they're decayed, they're painful, they're unattractive, they're spacing, they may be discolored. We basically, what we'll do is we pre-plan everything. So they don't come in day one. We take intraoral scans, which are like digital impressions. We'll take a CBCT, which is a CAT scan, basically, of their upper and lower jaw. We'll take a lot of photographs, and we'll come up with a game plan so that when they come back in, they literally have all of their hopeless teeth extracted, which usually means all of their teeth. And at the same time, and they're usually sedated, it's usually IV sedation. So at the same time that after we've taken out the teeth, we then start to place the implants. After the implants are placed, we do more digital scanning. We have a lab right here in our office, and we literally will print bridges that screw into the implants. So they come in with hopeless teeth, loose teeth, unattractive, decayed teeth, and they'll leave with an absolutely beautiful smile, literally the same day. So
Wow.
it's a life-changing procedure. It is extraordinary. I've had patients, break down and start crying in the chair. I've had patients, hugging me, and it's a game changer because the beauty of this procedure, and I had mentioned a lot of people spend years in the dental chair and they're getting fillings and they're getting a crown and they're getting a root canal, and then the tooth breaks and we're extracting it. It's a way to kind of stop that process of deterioration. It's also money saving because they've spent thousands, maybe tens of thousands of dollars on dental work that just didn't work. So they have dental treatment that doesn't work. So now they're coming to me and they're like, "Look, I want to stop this cycle. What can you do? I don't want to ever have decay in my mouth again." And you'll never decay, obviously, because it's titanium and ceramic. The implants are made of titanium, and then the bridges are placed on top of those implants. So we're kind of stopping that whole lifelong process for a lot of these patients where it's been just one thing after another and they just get frustrated. So I can give them a solution where they have this procedure done and it's really truly the last thing they ever have done in dentistry, other than coming in for checkups and x-rays to make sure everything's healthy.
Wow. Okay. And what has typically caused I guess, what led up to this point where they had this issue with their teeth? Is it something that is the way that they ate, the way they took care of their teeth? Is it just kind of like genetic and just part of their health and that's just how it is? Or like, I guess what leads people up to this point?
Right. So it's a combination of the two. It could be just really bad genetics. Some people are born with some conditions that where the enamel is really soft and they are very prone to decay and cavities. Sometimes it's neglect where they just haven't been to the dentist ever. I've had patients come in 30 years old, they've never been to the dentist, their teeth are loose, they have disease all over the mouth. And that's the other thing. A lot of the patients that come in, you can tell that they just don't look healthy because they have infection all over their mouth. That infection can get into the bloodstream. Most of our patients come in saying, I feel tired all the time. I feel terrible. When we take out their teeth, we see them a week to two after the surgery, and they look like a different person. Their skin tone is different. They just have more energy. They definitely have more self-confidence and self-esteem. So it's really, like I said before, it's a life-changing procedure for a lot of these people.
Okay. And advice would you give to people that would help them to kind of maintain their, I guess we'll call it mouth health, so that they don't get issues where they have like infections, like you mentioned, it can get into the blood, it can really affect their overall health.
Right.
Like what are some of the advice you would give aside from like, okay, you have to brush, you have to floss and all that, but like, what are some of the things that people just don't really think about, or it's kind of obvious, but people just doesn't come to mind?
Well, there's a lot of dental anxiety. There's a lot of dental fear. So we kind of specialize in that. We try to make the patients feel very comfortable in our office. We listen to them. We answer a lot of questions. We try to make it as pleasant an experience as possible because I've sat in that chair too. I know what it's like. Nobody really likes being in there. So my advice would be to patients to avoid things such as decay, abscesses, infections. It's really regular dental visits, x-rays at least once a year, so we can pick up a lot of these things before they become a bigger problem. Because if you neglect it, it's only going to get worse. I say all the time to patients, like they say, well, when should I do this? They have decay in their mouth. I'm like, well, it's not going to get any better. So the sooner you do it, it's just like anything else. Early intervention is always much easier than waiting until it becomes a problem. So with regular checkups, regular x-rays, professional cleaning with a dental hygienist, those are all things I recommend to prevent people getting to the point where it's very advanced.
Okay. And I know you also provide other treatments as well, crowns, veneers, laser dentistry. I want to start with the crowns and veneers first. Like for people who've never really necessarily had issues, or maybe they just never been to a dentist, so they don't know this. What's the difference between crowns and veneers?
Okay, so a crown is when the tooth either has a large filling or decay or it's broken, and a crown wraps 360 degrees around a tooth. So you're preparing the whole tooth, you're shortening it, you're narrowing it so the crown can fit over it. We do a lot of those. Veneers are more for teeth that are usually more healthy, but the patient just wants a cosmetic change without being as aggressive as trimming the entire tooth down to cover it with a crown. So a veneer basically is a new front on the tooth. It can close spaces. It's made of porcelain. So we take a little bit of the enamel away so the teeth don't look too bulky. It's made of porcelain and it gets bonded right to the front of the tooth. And it can close spaces. It can lengthen teeth if your teeth have been ground down. Some people have a condition called bruxism, which basically just means they're grinding their teeth at night, and they'll grind the enamel away so the teeth now are shorter than they used to be. They're unsightly, and the patient wants to restore their smile to the way it once was. It can also work with discolored teeth. Some people have antibiotic staining of their teeth when their mother was pregnant with them, and that will cover the tooth. A lot of times they'll have a very unsightly appearance of tooth, which is like a reddish brown stain strip across all the teeth. We cover that with veneers to give them back a beautiful smile again.
Okay. And when you say it's made out of porcelain, I'm sure people kind of have this in their mind that porcelain doesn't seem like it's very strong or very tough. I think about like my porcelain pot or something, and like it's very easy to crack. So
Right.
why porcelain? And actually, how strong is it when you use it in the mouth?
It's actually quite strong. Um, there are different forms of porcelain. Some for the back teeth, like a back tooth crown. We're going to use something that's called zirconia, which is a stronger material, so that if you grind your teeth, you won't break your crown. Veneers in the front typically are not zirconia. They're a different kind of a porcelain because they're much more translucent. So if you put something that's too opaque in the front of the mouth, it's going to look fake. So if you put something that's translucent, a translucent veneer bonded to the tooth, you're getting the strength of the tooth. So we don't really worry about fractures as long as once we cement the veneers in, the bite is right, and people can pretty much eat whatever they want. So yes, it is you think about a plate, you can, tap on it with a fork or tap on it with a knife, it's not going to break. If you throw it on the floor, it's going to shatter. So similar principle with veneers, where once they're bonded onto the tooth, they actually have increased strength. And it's the most aesthetic material that we have in dentistry today.
Got it. Okay. And then there's laser dentistry. I think that most people, and even for myself, when I think about like laser, like what would you use laser for in dentistry? So
Right.
what's the application for lasers when it comes to dentistry?
So there's different kind of lasers. One is a hard tissue, so you can't cut off a crown or you can't take out an old silver filling. But if there's early decay, you can actually use the laser, which will break down the enamel and break down the dentin, and you can replace the dental drill with the laser. There's also a soft tissue laser, and that's pretty much what we use. Soft tissue laser helps it trims tissue. If somebody has overgrown tissue, it helps to trim the tissue away. The same thing a scalpel used to do, but now the laser replaces the scalpel. We also use it for some cosmetic touch-ups. If the patient's gum line is uneven, we use our laser just to even out so everything looks nice and symmetrical and beautiful.
Okay, got it. And when it comes to, I guess, misconceptions, I'm sure that a lot of patients come in, they have these different misconceptions or myths that they believe. What would you say are some of those common misconceptions that you've heard from your patients?
I've heard implants don't work. The success rate of implants in our practice is about 97%. The reasons, well, when people say that to me, I say, okay, tell me more about that. How did you hear that? And it's always a brother-in-law, sister-in-law, a mother, a son who had implants done. They either weren't done correctly, or it was just poor choice of location for an implant, or poor patient selection. So if you have somebody who's a pack a day smoker, the implant is probably the worst procedure they could have. Do we still do it? Yes, but we caution them that there's a chance that because of your smoking, you're going to lose bone, and therefore you're going to lose the implants.
Mhm.
Also, another condition is diabetes. If we have a patient who's diabetic, that affects their bone. There are other medical conditions, certain osteoporosis or bone disease, immunocompromise, where the patients just aren't healthy, and you really want a healthy patient, so the success rate goes up. Not to say we don't do it. We don't do implants on diabetics or smokers, but we just warn them that they've got to keep their either stop smoking, or B, if they're diabetic, keep their blood sugar under control so that they'll heal properly. And then that greatly increases the chances of the implants working. One of the other misconceptions is, patients are fearful when they come in because they say that dentistry hurts. In our practice, we go above and beyond to try to make everything as comfortable for the patient as possible, to make it as pleasant an experience. And it doesn't have to hurt. If you can use a local anesthetic to get somebody numb, then dentistry should never be painful.
Okay. And is there anything that you kind of bring up to patients and they're kind of like, I didn't know that, or, oh, I didn't know that was a thing. Like, have you heard things along those lines? Or I guess what's like the most common in that situation?
A lot of patients are amazed, I think, when they come to our office with our technology, where we use handheld x-rays. So there's less radiation. We use sensors instead of film, so there's less radiation. We don't use any gooey impressions anymore. It used to be you go to the dentist and they fill a tray and shove it in your mouth.
What flavor do you want? They'll stick it in there and they'll rip it off.
Exactly. So everything is now digital. So we can literally prepare a tooth for a crown, and we'll use a digital scanner, an intraoral scanner, that'll show on the screen a 3D model of their teeth. And then we send that to our lab, and everything now we do some in-house, but if it's a cosmetic case, I'll usually send it out to get the optimum aesthetic result. But everything now is 3D printed or milled. So you've taken the human error out of it, having a person sit at a workbench, working on a crown. Now everything is done 3D and 3D printed.
Wow. Okay. So technology's really come a long way.
Technology's come such a long way. It makes it so much more comfortable for the patient. Mm-hmm. And it also increases the accuracy and the fit of crowns, of veneers, mm-hmm. of bridges sitting on top of implants, mm-hmm. because there's no variation. It used to be that if you took an impression, the impression could warp if it sat in the back of a FedEx truck, especially here in Phoenix at 120 degrees.
Yeah.
And they didn't get the impression in time. Things would not be accurate. Whereas with digital dentistry, you've taken that all out of the equation, and everything is, for the most part, I'd say 97, 98% of our crowns, we don't have to redo. Everything just fits beautifully and perfectly. But you have to invest in the technology. If you don't believe in the technology and you don't invest in it, then you're kind of selling yourself short, and you're affecting the quality of dentistry.
Okay. Now, let's say that somebody is looking for a dentist, and I would imagine that if you're looking for a dentist, which is general dentistry or teeth cleaning, it probably doesn't matter as much than if you're looking for someone who's more specialized, like the all-on-X or the veneers or
right.
things along those lines. So if someone's looking for a dentist and is looking for someone who can help with more of the specialized stuff, what advice would you give to this person so that they can find that dentist that has the experience, has the knowledge, and can really get them the result they're looking for?
Nowadays, I think it's so important to interview your healthcare provider beforehand. So make a couple phone calls and Google them and chat GPT them look at their experience, look at their training, look at how long they've been doing it, look at their reviews on Google. I think we've got like 275 reviews on Google, and all but two are, I think, all but two or three are 5-star. We had a couple. It was more of an administrative insurance issue where the patient wasn't happy. We, tried to go back and make them happy, offer them, a service or a credit or whatever the case may be. But I think you've really got to look at someone's experience and interview them and ask them important questions. How many of these procedures have you done? How long have you done it? Have you been doing it? What happens if it doesn't work? What's your warranty? I think just, an educated patient is the best patient.
Okay. And when it comes to your approach to patient care, what role do you believe creativity plays? I think when it comes to medicine, it's typically, okay, you get to do it this way, and there's this protocol
Right.
for doing it. But what role do you think creativity plays in what you do?
Oh, it plays a huge role because I always try to listen to the patients and kind of listen to where they've been, where they want to go, where they are right now. And I always try to give them options in terms of, okay, this is where you want to end up. We can go, 0 to 60 and get it done. And I could do it, at my next available opening, or we could do it piecemeal and not affect the end result, but try to keep it a little bit more comfortable for the patient, both time-wise, financially, taking into account their anxiety level, et cetera. So I try to be as creative as possible in coming up with a game plan that they're going to feel comfortable with, not only from a dental standpoint, from a financial standpoint, and from a time standpoint. So I'm always offering different options for patients from that regard.
Okay. And when it comes to the future, like, where do you think the future of dentistry is going?
Um, I think the future is really bright just based on the technology and the ease, the relative ease at which we can do things for patients. Most times we had a patient today who came in and needed a crown, was going out of town. So we saw her, we 3D printed her crown in the office, and she left about an hour and 50 minutes later with a new crown cemented in.
Huh.
So, I think that's exciting. One of the roadblocks that we constantly come into play with is dental insurance, because a lot of people, their need for dentistry far exceeds what their insurance is willing to pay. And I always tell the patients, I'm not treatment planning your case or your mouth based on what your insurance says. It's based on what I see, based on my experience, and what I know is going to work. So that's kind of always an uphill battle. But I think once patients realize that you're not, that you really care about them, that you're not just doing it to do it, you really want the best for them. I think that they understand that insurance is only going to pay a small portion to get them to where they ideally want to be.
Okay. And with that future in mind also, what is the vision you have for your practice?
So we're constantly evolving. We are constantly improving. I'm constantly going for more training. I just flew to Lisbon, Portugal, to learn a new implant technique that the only people that do it here in the U.S. are people that are trained with this doctor he's based in Portugal. So we flew there, my wife and I flew there, and took his 4-day training course, learned new techniques that now I literally incorporated into my practice when I came back, like the first week I came back. So that's exciting. I think, staying up to date in terms of technology, in terms of materials, in terms of techniques is extremely important. And that's where I see my practice going, constantly evolving, becoming, better and better each day.
Okay, that's fantastic, Dr. Greg. I do have one last question for you, but before I ask it, I do want to point people to your website at smilepcd.com. Now, last question for you. What
Sure.
does beauty mean to you?
What's the what?
What does beauty mean to you?
Beauty, I think, is that's an interesting question. I think beauty is how others see you, um, in terms of just your effervescence, your vibrance, how you carry yourself. But I think beauty is also what you see in the mirror. So, you know, I think if you look in the mirror and you're happy with what you see, to me that's beauty. Beauty also, as a dentist, is an absolutely beautiful smile. Like when I talk to people, I'm constantly staring at their teeth. That's the first thing I notice. Um, if they're wearing sunglasses, I always have to catch myself because I don't see their eyes, so I'm literally staring at their teeth. But yeah, I think um, if you look at some of our before and after pictures, like on our website, or you just Google before and after cosmetic dentistry, it just changes the whole person. It changes the way people see them. It changes the way they feel about themselves and the way they see themselves. But I think also it's deep down that self confidence, and high self esteem. For me, that's a beautiful thing. That's beauty. Just having somebody who you can tell is just comfortable with themselves. They're not. They're natural. They're not. Playing to the camera. They feel really good about themselves, and you can see it in the smile.
Very well said. There you have it. Dr. Greg sharing his expertise. So, Doctor, where can people contact you and your practice?
So they can contact me through our website, thesmilepcd.com. They can also. Do you want me to give you a number?
That's fine. Yeah, if you want to share your number.
Yeah. So we're located in Central Phoenix. We have a beautiful office, and our number here is 602-861-1245. Or they can go to smilepcd@gmail.com and send us an email with an appointment request. We'd be happy to see them as soon as I always try to see patients as soon as possible. So especially if you're in pain, you're coming in the same day. I don't care how many patients I have. We're at least going to see you and get you comfortable and at least give you peace of mind. And then if we can't do anything or don't do anything that day, then we'll do it as soon as possible to get you out of pain. But that's always my primary focus. If you want to be seen, I'm here, and I'd be happy to see you.
Well, Dr. Greg, this is great. Thank you for coming on. Thank you for sharing knowledge, and
Thank
thank
you,
you for
Daniel.
your message.
Okay, great. Thanks so much. I appreciate it. It was a pleasure being here.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.